Hi, I'm Sarah Clark with Disability Counseling Institute. Thanks for joining me. I'm going to speak briefly today about barriers to services. This is one of the primary reasons that I started teaching therapists and other providers about ADA compliance and disability awareness. This is key to being inclusive and having a good working relationship with patients or clients with disabilities. Consider the general practice, a general office space if you're going in for an appointment. So typically the way that this starts, if you're going to see a new provider, you contact them, you make the appointment in one way or another. They sometimes will give you information about how you're going to locate the office building. They'll give you directions to that, give you a suite number sometimes, but it doesn't typically go beyond that. And unfortunately, many people with disabilities, either because they're new to their disability or have had unhelpful providers in the past, don't ask all of the detailed questions that they need to ask. So for this example, I'm going to be speaking about a person with a visual impairment or who is blind. This is a very specific disability type that needs very specific accommodations that very rarely get considered. So once the person has made the appointment, they're going into the building, they know the address, they know the suite number, so they can at least figure out how to get there. They start running into barriers at this point. Sometimes there are buttons, keypads, intercoms, things like that need to be pressed to be able to access the building to begin with. Then once they enter the building, there are usually Braille numbers on elevator buttons because that is an ADA compliance factor, and most buildings are going to try to be in compliance with that. Often, but not always unfortunately, different room numbers, suite numbers have Braille to let you know what their numbers are, but it doesn't go beyond that. So other signs that have the name of a practice or points with arrows to, the different sections of the building once they get on the floor of the elevator to know whether to go left or right, that's typically not accessible either because it doesn't have Braille on it or because they're put in different locations where a person who is blind wouldn't know how to locate the sign or where to even begin to look for the sign to find the Braille. Then the next step of it is once they've found the office, they walk in and usually there's a reception counter. Sometimes there's a glass partition, sometimes not. Sometimes there's a person sitting behind the desk, sometimes not. But the protocol that people are supposed to follow when arriving to the office is usually provided with visual cues. So there might be a bell on the counter with a little sign that says to press that for assistance. There might be a sign on the glass partition that says to hit a buzzer or to wait to be acknowledged. There might be signs that say the receptionist is out of the office for the day or for her lunch break or something like that. But all of that information is visual, and somebody who does not know how to expect that would not know how to access the information that they needed. Then typically there's a sign-in sheet, and this nowadays sometimes is a tablet rather than paper, but either way, there's a clipboard with a piece of paper, and you'd have to be able to see the piece of paper to know where the next empty line is to be able to sign, unless somebody were to assist you with where to sign. And if it's a tablet, usually those are not the types of tablets that can be accessible, like an iPad that would have voiceover that they could turn on and access the information that way. It's not typically in an accessible format for people. And then we get into the interactions. So those are just the logistics for accessing the appointment and being able to get ready for the appointment. So then services. If the provider has provided the documentation, intake paperwork, all of that beforehand, then the person can just wait for their appointment. Oftentimes, though, they'll be handed a clipboard with papers that they're unable to fill out, and then the person at the reception desk or the provider themselves, if they don't have a receptionist, uses the appointment time or asks them to sit in the waiting room and go through that paperwork, and they dictate their responses. Asking them to do this in the waiting room is extremely frowned upon, because if anybody else is in that waiting room, you're violating their privacy. Anything that is asked is going to be private health information that people would not want to announce to the rest of the room or have other individuals who are not part of their care team hear. So if this is your protocol, make sure to consider how privacy can be protected in those situations. And then as you're going into the appointment room, oftentimes a provider would not know how to perform sighted guide or even that they should offer it. They will do some different things just depending on what their comfort level is with people who are visually impaired. Sometimes they will just do what they normally do and say hello and introduce themselves and then start walking back towards the appointment room and expecting the person to follow, and they've taken off and the person doesn't know where they are, how to follow. The other thing that sometimes happens, which unfortunately happens pretty frequently, is a person will reach out and grab the visually impaired individual's hand or arm and start pulling them to guide them. And not only is this not effective and not safe for the person who's visually impaired, but it's also an offensive way of handling the situation. It's not how you would typically treat an adult or any individual that has the ability to get themselves to a particular location. So consider how that would make a person feel. There are very specific techniques on how to guide a person who's visually impaired. You can offer sighted guide, and this is a technique that you can look up videos on how to do, but it's very basic technique. You just offer your elbow to the person and they hold on, and then you walk at a normal pace and they keep up. And that way they're in control. They can feel your movements. They can feel when you turn, take a step up, take a step down, but it gives them control over the situation. Oftentimes people will say no thank you if you offer that, and they will just prefer to follow you using their cane or guide dog or remaining vision if they still have some functional vision. But the key with this is if you're having somebody follow you, you want to walk at a normal pace and you want to keep a conversation going. So that way, especially if it's a busy office, they don't get confused by the sounds of you moving through space versus, all the other people around you. But if you're talking to them, they can follow the sound of your voice. If they have a guide dog, they can have the guide dog follow you in particularly. And it alleviates the feeling of being forced into a level of dependence that would happen if you weren't providing those alternatives. So think about how a person would feel if they were to walk into your office for an appointment. Think about the barriers. Think about specifically how a person who is blind or visually impaired would access your office, access your suite, access your materials, and what procedures you have in place that might not be inclusive. Because having an appointment like I just described, with all those different barriers getting into the building, barriers getting into the office suite, barriers with paperwork, and then a particularly offensive method of assisting once you get to the office will turn a person away. And not only will it have a negative impact on your working relationship with that person and may damage it to the point where they won't return, but because having an inaccessible office or inaccessible services is more of the norm than the exception, it oftentimes will turn people away from seeking out other providers. So this is extremely important and is a thing that I would like for all providers to start considering as part of their business practices, part of how they provide services and how they consider being inclusive with those services.